Welcome back to the Arizona Daily Mix. Mental Health Month is one that we definitely need to take a look at. It's very important right now. And joining me from Southwest Behavioral and Health Services is Paul Buttermore. And Paul, right now, I said it before we came on here, but we are in a mental crisis with this pandemic and us coming out of quarantine. And you were saying, yeah, this really took a big toll on a lot of people's mental health.
Yeah, we've seen a lot of increased, substance use, depression, fears, the fears around the pandemic, around people's, a lot of unemployment. People have fears just about everything. And we're social animals, so we're really kind of missing that personal contact.
Right, and that's one thing about with mental health. I think we have to break the myth because everyone thinks of, homeless people. They think of, the mother having the nervous breakdown. But we've been watching, regular people, our own friends, go through these struggles.
Yeah, we really have. I think there are a lot of myths that need to be dispelled. I think that, we're seeing an increase in depression, for example. And, and some people may not even be aware that they're actually depressed. I think that's through education and things like this, for example.
Yeah. Now, you guys do serve the homeless community. And let's talk about the connection between homeless and mental health illness.
So I believe that that's probably one big myth as well, that our homeless population there's a mental illness capacity to that. We've seen it, like I just said a second ago, we've had an increase in unemployment, and affordable housing in Arizona is kind of lacking. We're seeing a lot of folks with just some situational mental wellness issues that are struggling with being able to maintain a basic apartment. But we do provide services, for the homeless population. We help them get housed and stay housed, for example.
Yeah, it's so important what you're doing. I think it's also important to recognize yourself, people at home, or if you're watching this right now, is to recognize that everybody goes through a mental health problem. It affects everybody, and don't think it won't affect me. Oh, no, I'm fine. But in some little way it can, and that's one thing we need to address.
Yeah, I think that self-awareness is really important, more so even today. Because we have friends and family that maybe recognize changes with us where, as we're coming out of the COVID quarantine, we're able to see more people, but we've still got to have this awareness and be able to maintain a balance. We talk a lot about physical wellness, but we don't talk enough about mental wellness, and they affect each other.
Yeah. Let's change gears and talk about our children, because our children have been home. They've been moody. They've been stranded. They've been feeling abandoned. And I think some parents chalk it up as, well, that's just them and their growing pains. And they kind of like push aside that those are kind of the first signs of mental illness and needing help.
Yeah, definitely. And I think back to the situational, our kiddos are used to being able to run free with their friends and be on the playground. And here we are putting them in front of a computer to monitor for 6 to 7 hours a day. And the social aspects, the environmental, and there can be genetic. The mental wellness or mental illness, it definitely can be affected with genetics. And our kiddos, they can be tested and treated as well.
Let's talk another quick myth, and that is about mental illness, and people who have mental illness problems are violent, they're unpredictable, and that's kind of like they always want to throw that label out when we go through something tragic or something happens. Let's touch upon that.
I think that's a myth that it makes me cringe when I see it, where there's some violent event and they automatically go to the mental illness piece. We work with many of our folks that we work with, not just in my business, but in just the general community, maybe struggling with something you'll have no idea. Violence and mental illness do not go hand in hand. It's a small part of the population, probably no different than anybody that didn't have mental illness.
Yeah, it's just so incredible how we do put a label on it. When we got to stop putting labels like that when things happen, and we got to start paying attention to each other and people, and especially at work. Those are one things that we really got to focus on our employees and our friends and stuff.
I think that, and we do, and we have to look for changes in behaviors with our, especially during these trying times, looking for, isolating behaviors even more so than what we kind of see, and being able to engage in that difficult conversation, potentially with staff or with our friends. Compassionate listening is really important with that, not trying to be a fixer and tell people what they need to do, and ask them what you can do to help them.
Yeah, I'll tell you, Paul, I could sit all morning long and talk with you about this, because it's definitely something that we need to address and talk with each other and stuff to help out. But let people know right now how they can get a hold of you for them to want to talk to help them.
So our website is sbhservices.org. It lists all of our services and all our phone numbers. And if people are in crisis, for Maricopa County, the phone number is 602-222-9444. And don't hesitate to make these calls. If you have concerns about family members, and that maybe we want to do whatever we can to save people's lives.
Yeah, and especially right now, especially as people are starting to, again, seeing their family members or friends for the first time as we come out of this pandemic and mask off, and you will see some of the signs. So it's great to get a hold of you and talk. So, Paul, thank you very much for joining me this morning.
Thank you, Brad. I appreciate your time as well.